Welcome to the Tier 1 Health and Wellness Podcast, and today it's my pleasure to introduce you to Dr. Chris Bronson. He runs B3 Clinic. It started in Sioux Falls, South Dakota, but I think he travels a little bit and runs clinic out of various other areas, but nonetheless, he's readily available. I've been really impressed with some of Chris's work. I'm a big fan. I've seen some of his videos. I'm very impressed with the video that he did, and this is really how we met initially. Via my comments, congratulating him. What a great video he did with the anabolic doc on estradiol management in men. It was good to see at the end, kind of the anabolic doc kind of squirming at that information that you had provided that, maybe contrary to what he may do or believe, but nonetheless, very impressive. And Chris does have a very strong interest in the benefits of estradiol in men. You can never talk enough about that and teach men about how important estradiol is in men and how testosterone actually works through its active metabolites to give you those benefits. He also does a lot of work on harm reduction in men that are on synthetic androgens. So, Chris, if you don't mind, kind of tell us a little bit about yourself and once again, talk. Let's stay in your wheelhouse. You tell us all about estradiol management in men and the benefits as well as that harm reduction.
Yeah, sure. Well, I did that anabolic doc interview. It's about a year now
Mhm.
since I did that, and I think when I did that, it was very controversial. A lot of people came out and they have very strong opinions on estrogen in men in general. And I don't think when I said that testosterone therapy is also estrogen therapy, that was really controversial. A lot of people didn't like that, and a lot of people, I guess, didn't realize that actually testosterone is a prohormone mostly, especially in the brain. So most of testosterone's effects that are beneficial, medically speaking, come through estradiol, come through local aromatization, aromatase being the enzyme that converts testosterone to 17 beta estradiol. They come from direct signaling effects on estrogen receptors or other, non-classical receptors. Um, there's a lot of details there, but these are things a lot of people don't realize. And so the concept in if you want to call it the TRT space, or mostly these are like bodybuilding forums and similar places like that, that have taught for years that you need your testosterone level high and you need your estradiol level low or in the quote unquote normal range, whatever that means. There's a lot of problems with the whole concept of normal range, but that's probably a discussion for another day. What do I mean when I say most medical benefits of TRT are a result of estradiol? Well, number one, to me, medical testosterone therapy is most of the benefits come from its effects on your body composition. In particular, the fact that testosterone is one of the few drugs that can reduce visceral fat. Visceral fat being the fat, not the pinchable fat externally, not our subcutaneous fat, but the fat that is internal, that surrounds our internal organs. Visceral fat is highly inflammatory. It secretes what are called adipose cytokines, which are inflammatory chemicals like TNF alpha, interleukin 6, there's a bunch of others, directly into the portal circulation of the liver. And this is the cornerstone of what underlies all the sequelae you see of metabolic syndrome. Metabolic syndrome being, basically excess visceral fat. It's not just obesity, but excess visceral fat with chronic low-grade inflammation that causes a variety of problems, high blood pressure, atherogenic dyslipidemia, and actually predisposes you to many other chronic diseases, including several types of cancers. So the fact that TRT is able to reduce your visceral fat is a very, very important medical benefit of TRT. The only way that you get a visceral fat reduction, this has been shown in actually several clinical trials. So this is not just a mechanistic thing, it's not just my opinion. This has actually been shown experimentally several times, is through local aromatization to estradiol. And it's the estradiol that actually inhibits lipogenesis inside your visceral fat depots. And so we know, for example, that patients on testosterone who also take estrogen lowering medications or estrogen blocking drugs, which we commonly say aromatase inhibitors, but I mean, there are other ones that reduce your estradiol as well. There are even some synthetic androgens that do too, at least indirectly. Patients who take those drugs do not get anywhere near the same visceral fat reduction benefits. And like I said, we know that from studies, but I know that from my own personal practice because what I do, which I think is unique to many doctors that prescribe testosterone, is I do body composition scans. I do in-body 570 or DEXA scans. So I look at people's visceral fat every 3 months. Not only do I closely monitor their blood pressure, their hematocrit or their red blood cell count, all the things that you would typically monitor in a TRT patient. I also look at how their body composition changes, what happens to their skeletal muscle mass, what happens to their percent body fat, and what happens to their visceral fat. And I have noticed in several patients that I've had, usually they transfer out of the care of other providers and they've been on estrogen blocking medications for a long time. Their visceral fat mass doesn't really change until they get off the estrogen blocking drug. And once they do that, their visceral fat goes down. And then other things start to happen that are beneficial. Their insulin sensitivity goes up. Um, their sex drive improves, their skin quality, hair and nail quality improves, their insulin sensitivity improves. So there's been many studies on testosterone and looking at the effects of testosterone on blood glucose control. And some of those studies have been equivocal. Some have shown no benefits. Others have shown benefits. Most of the recent studies show benefits, especially long term. In fact, interestingly, some of the recent studies show benefits even in men with pre-treatment testosterone levels that are normal.
Times insulin resistance is aging, aging is insulin resistance. What we're trying to prevent with hormones, nutrition, and exercise is insulin resistance. We're trying to prevent it or reverse it in our men. And you brought up the fact about increased visceral body fat versus subcutaneous body fat, and I want you to keep going. But a good example is just look at any autopsy of bodybuilders. They have a lot of lean muscle mass. They have no subcutaneous body fat. They look, or so they think, they look like the epitome of health. There's nothing healthy about that.
Nope.
Whenever you do that, whenever you decide to go to synthetic androgens, you've just made the conscious decision that I'm going to sacrifice some of my health for increased lean muscle mass and strength. But when you look at their autopsies, even though they have tons of lean muscle mass, no body fat to speak of, they have a lot of visceral adiposity, fatty heart, fatty liver, fatty intestines, you name it.
Oh, yeah.
They die from the inside out. It's like and that's what I say. They're rotten from the inside out, and that's the real issue. And what kills them are the non-aromatizable androgens they take and the aromatase inhibitors. That literally is what causes most of the harm. It's not the
I,
anabolic
I,
steroids themselves.
I definitely believe that's true. When I've said that, a lot of people push back on that, and just because there's no direct experimental evidence, but it does make sense. Actually, that brings up another point that I touched on this in my anabolic doc interview a year ago, but I didn't go quite as deep as I probably should have. So the FDA back in February removed the black box warning on testosterone and cardiovascular risk. And that was widely misunderstood by people to think that, okay, now the FDA is saying TRT for life, and every man who takes testosterone at whatever dose they take it at is 100% safe for your heart. There's no cardiovascular risk at all whatsoever. Well, you know, and I know that's actually not what the FDA said at all. What the FDA was saying is that at the present moment, there's no good experimental evidence that testosterone therapy increases the risk of major adverse cardiovascular events beyond a man's baseline risk based on his age and other risk factors. That was a result of the Traverse trial published in the New England Journal of Medicine, June 2023. That's why the black box warning was removed. But it was not a statement about testosterone's 1,000% safe. There are no risks at all whatsoever. One thing that I've realized looking at a lot of the epidemiologic research on synthetic androgens and even a lot of the mechanistic research, there's not great research on anabolic steroids in just we don't really do studies in guys using steroids like
Right.
longitudinally for obvious ethical reasons. But one thing that is abundantly clear is that androgens, all androgens, including testosterone, under certain circumstances, can have a pro-inflammatory effect on the heart and on endothelial cells. That effect appears to be dose dependent, like most, negative effects of most drugs are dose dependent. But most importantly of all, it appears that the way that your body naturally attenuates or reduces this effect is with estradiol. Estradiol is actually the antioxidant in the heart and in endothelium for what androgens do to mitochondria. So in effect, testosterone, and there are complex reasons why it does this, but it increases the rate at which your mitochondria produce energy, ATP. An effect of that is you can get oxidative stress. So if you think of mitochondria, that's the organelle inside cells that produce most of the energy for the cell. If you think of mitochondria like engines, well, what happens when engines run really hot? They can produce sparks, right? Well, mitochondria produce sparks as well, but they're called free radicals. Free radicals have to be buffered by a very complex antioxidant system. And it turns out when it comes to testosterone, testosterone buffers its pro-oxidant effects through estradiol. And how does it do that? It gets locally aromatized in cardiomyocytes and in endothelial cells to estradiol, and estradiol does two main things. Number one, estradiol upregulates all the antioxidant enzymes that scavenge the particular free radicals that testosterone causes your mitochondria to produce, but it also directly scavenges them. A lot of people don't realize that estradiol is an antioxidant just based on its chemical structure. Okay. It has the ability to directly neutralize reactive oxygen species. And it does that by donating a proton. And then because, we call the enzyme aromatase because it adds an aromatic ring. The aromatic ring structure is very important because once estradiol donates its proton, it gets stabilized through resonance. That's what an aromatic ring is. It's a way of stabilizing a molecule with an unpaired electron so that it itself does not become a radical that can damage the cell. So when I realized that that was the mechanism, and that was a paper published in 2020 in the journal called Redox Biology, where they elucidated that mechanism, that's an extremely important thing for people to understand and for people to know, and particularly relevant for, like you said, bodybuilders who use very super physiologic doses of androgens,
Right.
is that when you have an extreme imbalance that's artificially induced between your androgen load, testosterone levels, whatever, DHT, other, alien androgens, and its natural antioxidant estradiol, you cause damage to your heart and endothelial cells. And what does that look like in the heart? Well, it looks like exactly what many bodybuilders die of. Okay, they die of, there was a paper published in May of this year, sudden cardiac death in pro bodybuilders, and the risk is actually very high compared to the general population. Um, and what that looks like is you have a long duration of unopposed testosterone or androgen activity in your heart and endothelium. And in the heart, what happens is when you have a lot of oxidative damage, eventually some of those heart muscle cells die. When they die, your immune system comes in to clean up all the cellular debris and it forms scar tissue. Okay. It deposits collagen. That's a problem in a tissue like the heart, which relies on coordinated electrical activity, right? Scar tissue doesn't conduct electricity very well at all. So this is the reason why you see many bodybuilders die of arrhythmias and of
Correct.
hypertrophic cardiomyopathy, and this is the effect that it has. And I do believe very strongly that it's a story of estradiol
Yep.
because we also have evidence, for example, a lot of older bodybuilders, Arnold Schwarzenegger, um, Dorian Yates, a lot of these guys that were active in the even before the 90s. Well, they have tended to live longer, and lately bodybuilders die younger and obviously much quicker than they did in the past. So what would the reason be for that? Well, we haven't had aromatase inhibitors until about the mid 90s, right? So ever since aromatase inhibitors were introduced for the treatment of estrogen receptor positive breast cancer in women, it wasn't designed for men at all. Um, that's when I think we've seen the spike in mortality and just the overall Dunning-Kruger effect of these various bodybuilding coaches or whoever gives people advice on androgens that, oh, your estrogen needs to be so-called controlled. Well, the whole concept of estrogen control is absolute and utter nonsense in the context of TRT or any form of exogenous androgen therapy, if you understand that the two things are interrelated and work together. I mean, not only do most of the benefits of the test, and I would say most of the benefits, maybe that's overstating it a little bit. I don't know if you'd agree
I
with
would say it would
most.
at least
At
half
least
the benefits of testosterone come from estradiol, its
we
conversion
can
to
say a
estradiol.
huge
Yeah,
percentage of the
absolutely.
benefits
Well,
come
yes,
from
we
estradiol.
can talk about that. So let me help our listeners kind of understand, some of the things that you've explained, maybe explain it in a different way, so hopefully they kind of
Yeah,
understand.
I'm a little bit wordy and
No, no, it was perfect. It was just very, scientific and it's excellent and it's all true. Our listeners didn't understand that during our normal daily metabolic processes, the human body constantly produces what's known as oxygen-free radicals, as Chris has talked about, and about 95% of them are reactive oxygen species, such as the superoxide anion, the hydrogen peroxide, and the hydroxyl free radical. And so, as he's explained, normally there's a dynamic balance between the body's oxidation system and the antioxidant defense system. And when they are out of balance, pathology occurs. The pathological damage is going to occur, and that's what's known as oxidative stress. And then when you look at studies looking at men and women, you show men are more susceptible to this oxidative stress and they have an actual lower antioxidant capacity than females. And this sex difference, of course, is attributed to estrogen.
Mhm.
As he has already alluded to, estrogen is known to promote the activation of antioxidant systems. It regulates the expression activity of a number of antioxidant enzymes. Very important that you don't block it when you take estradiol, just like we didn't need to block it when we were in high school and college age. We had great testosterone levels. We had a great estradiol level to reflect that. The better your testosterone levels are, the better your estradiol levels are. Let's talk about that really quickly. The measurement of estradiol is a it's an inaccurate measurement. When we measure what's in the serum, it's just what's produced peripherally by the adipocytes, not what's at the tissue level. When you block the serum levels, to lower those serum levels, you are blocking it in the tissue. That's when you cause the harm, even if you block it just a little bit, as they will say.
Yeah. Yeah.
Estradiol mitigates insulin resistance, induced cardiomyopathy in the heart. It's what it
Yeah.
does. It improves
Yeah.
cardiac function. Of course, it is
Also,
responsible for increased.
it's also worth mentioning that you block it in the brain as well, since
Oh,
most,
I've been big on that forever. It's
yeah,
yes. Well, when you block it peripherally to lower the serum levels, you're blocking what in your brain, your bones, your heart, your blood vessels. your sexual organs. Look, your brain is loaded with aromatase activity. I mean, loaded. And there's a nice review on that very topic. I've got a talk prepared, almost finished, talking about a lot of these issues that you are and presenting the literature to support that. But also, it was really based on some of the comments from your uh, lecture that you gave or your YouTube video, along with Dr. Andrew Wingy as well. And so I have put together these common, attacks that they have when you do a video like that, talking about blocking estradiol in men. There's always that AI crowd that's going to come in and attack you. And so from this point forward, I'm just going to present medical literature. I mean,
Yeah.
whenever I give an actual lecture, it's just going to be the medical literature and leave it at that. But we do know the importance of estradiol in men. The way we figure things out like that, and I'll present some of that, is that we look at men that undergo androgen deprivation therapy. And we understand, we see the importance of estradiol in men by what happens when they don't have any estradiol, and then what happens when we give it back. And so everything that you're pointing out, and we can go into more detail, is absolutely correct. Men also, this is really what gets them all in trouble, is the normal estradiol range. No one knows where that was derived. Listen, I called LabCorp and Quest. Where did you come up with your normal estradiol levels? Where did that come from? LabCorp got back with me. Their head director of the laboratory was Dr. Kelly Chung, and she said, "We don't have that data anymore. It's from a couple of decades ago. We don't know anything about them, so we know nothing about the biometrics of the men. We don't know anything about their testosterone levels. So men are trying to get on testosterone and keep their estradiol levels at a range that we know nothing about the men that range was derived from. But more importantly, the way we look at the normal range for testosterone and estradiol are incorrect. What we should have is an estradiol range, a normal range for 95% of men with differing testosterone levels in the same group of men. So if you have a testosterone level of 900, this should be your normal range of estradiol. If you have a testosterone level of 1200, this should be your normal range. And that would keep a lot of men out of trouble. They would not
Sure.
be trying to keep it down below, 35 or so, or 25, that some do. You would never do that because I'll be presenting the paper that shows that when you give testosterone to men in various dosage, even up to 600 milligrams a day, you're going to get a corresponding increase in estradiol because that's how testosterone works. That's what Dr. Bronson is telling us all, is that testosterone works through estradiol to give you the benefits of testosterone in
Yep.
so many important tissues. And when you block it, it causes harm. We still don't have a single study, a single randomized control trial showing that blocking estradiol in a man on testosterone is beneficial. Not one. What I can present and what he can present as well is the damage that occurs when you do.
Yep.
And so I'll be presenting some of those studies as well. But the fear is that it's going to just keep going up, that your estradiol is just going to, these words they'll use, just going to go to the moon, just going to sky high. It can't. Now, every man has his own normal estradiol range. That's a genetic variation in all of us. I'll be presenting that study. So what we're talking about is there comes a point I can raise testosterone levels to the tens of thousands. Dallas Carver, who died, I believe his testosterone level was 55,000. We can raise testosterone levels indefinitely by administering testosterone, but we cannot continue to raise DHT and estradiol. There is a saturation point. This is just physiology that nobody can get away from. We can't get away from the physiology that there's only X number of enzymes to convert testosterone to DHT and estradiol. And once those enzymes are saturated, you can't raise it anymore. I do not care how high you raise testosterone. And I'll be presenting the study that absolutely shows this.
Yep.
And like you said, the bodybuilders have that Dunning-Kruger effect. For those people that don't know what that is, that's basically people that don't know what they don't know. But they'll tell you they're the experts, the greatest experts when it comes to testosterone and everything anabolic. Yep, they may know how to stack anabolic steroids and how to get real huge and all that, but they also know how to kill themselves at the same time, and they end up by blocking the estradiol.
Yep.
That's really what we're getting at. So I'll talk about a lot of those things in a presentation with medical studies, but everything that you're saying is spot on. And so
Yeah.
please continue.
Well, there's a third reason. So, we cover why you get most of the benefit. Well, I would say many of the benefits of TRT are from estradiol. That's one re thing. The other thing is estradiol counterbalances the negative redox effects of testosterone, particularly in the heart and blood vessels. But there's a third reason to not so-called control your estrogen, block your estrogen, And that's the fact that most of the side effects of TRT that are blamed on estradiol have absolutely nothing to do with estradiol.
Yes.
I see it very commonly. My acne is a lot worse. I need to take an aromatase inhibitor. Well, that's far more likely to make your acne worse